Let's get rocking. Well, good morning, everyone. Thank you so much for joining us. I'm Lynn Jarman-Johnson, Chief Marketing Officer with Consumers Credit Union. Boy, what a panel we have for you today.
And I'm Dan McGraw, CEO of DPT Solutions. I agree. Lynn, I forgot your name all of a sudden. We've got a great panelist of people, which I'm super excited to hear from. We didn't even get to hear from them really before the meeting, so super excited. Today, we have part one of a three-series webinar. And today, it's really the new employee experience. So we know we've got quite a few people hopefully going back to work in the very near future here. And so this will kind of kick off the webinar series, and then we'll have two more following, which will be the next one will be the new business and consumers webinar. And then the new tech idea and new tech experience webinar will be our third webinar of the series. If you've got any questions or need any info on the remaining webinars, feel free to email us at info@dptsolutions.com, or you can go to Consumers Credit Union website, ConsumersCU.org, and do a webinar search series, and it'll show up there with the registration links.
So for some housekeeping tips for all of us, all lines are muted today in the webinar. Panelists, of course, are not. We will open up for chat at the end of the webinar for a Q&A at the end. And a link for today's recording will be available afterwards. So we're really excited to provide that for anybody that you'd like to share it with.
Absolutely. So let's introduce our panelists. We have Shawn Premer, Chief Human Resources Officer from Consumers Credit Union. Thanks for joining us, Shawn. We also have Joe Jones, President and CEO, Urban League of West Michigan, and a member of the Kent County Back to Work Task Force.
We have Callahan, our community impact expert with Acrisure Benefits Group, and Nikole, Canute, who's an attorney with Mika, Meyers. Just awesome panelists with expertise on many, many subjects. And we've got some really good questions for you. There's no question that Michigan has been hit really hard by COVID-19. Our state is definitely in the national news, it seems consistently. Yesterday, a report from Wallet Hub ranked Michigan as third highest in unemployment rates caused by the COVID-19 pandemic. Now, as our stay safe, stay home order is lifted, how can we build a clear path to return to work? Shawn, let's start with you. Are there rules for reopening? Are they set in stone? What should we be doing as employers to help our employees?
I mean, I think the number one rule, though you won't see this written in any, guidelines, is doing what's best to keep your employees and your customers safe. And so I think if you always keep that as your number one rule, then following the rest of it will be very easy and simple. But yes, there are indeed rules that we have to follow. Rules include requirements of, PPE, which is, protective equipment, sanitization, social distancing, and really making sure that we as the employer are holding ourselves accountable and our employees accountable for following those rules. And, at the end of the day, it's really about equipping your employees with everything they need to keep themselves and customers safe. So for us, it's creating PPE kits for every single employee that includes a personal hand sanitizer and a mask and all of those things, along with instructions on how to use them and how to sanitize everything, and then sectioning off, areas of our organization to make sure that we can keep social distancing in all instances.
That's great. Thanks for that, Shawn. Ann or Joe, do you have any comments on that?
I agree with Lynn saying that, this has been happening for a long time now, and we got to put a plan in place. And Shawn's correct, especially with her organization. There's, 26 locations, Shawn, you mentioned yesterday. So if you are with an organization that has multi-site locations, you really need to make sure you're doing the same thing at all locations, because every employee talks to each other, and especially with social media. So you just want to make sure you're covering all your bases at all your different locations.
And to recap on that, is there a formal plan that must be put in place? What are employees looking for in the sense of saying, are there specific rules, or is it you know, the formal plan is there, but there's a moving target that might happen.
What I've heard in several discussions over the past couple months is that designing a return to work plan is prudent for companies to do, just to make sure that their employees know that they're preparing for them to return to the actual physical workplace. So some things I've seen and people have suggested is form a return to work planning team. That team can consist of a multidisciplinary team developing, implementing, and monitoring the return to work plan. This team should be comprised of company leaders, such as someone like Shawn from your HR department, legal, information technology for those people that are still working from home and those that are still coming back in the office. You got to make sure your IT department's on board. And also operations and health and safety are as well very important. And also too, you need to debate based on where you're living and what city you're in, and the district public health guidance needs to be followed, because obviously with the media that's being given to everyone. So you need to make sure that you're following that, because your employees will know that you're doing the right thing based on what they're hearing in the media as well. And you have to be flexible. Every company is unique and has different plans based on their locations and local requirements. And actually, obviously, what they do. Are they in professional services? Are you in a manufacturing plant that needs to redevelop a line, and so to speak? And also, too, it's critically important to develop and implement workplace controls. So if you are putting together different scenarios, you need to make sure that your workforce is in tune with what prevention measures, as Shawn stated earlier. What are you doing? Do you have signs up saying, you know, wash your hands, cover your cough, just the basics of it all? And then putting in place, you know, workplace ventilation systems and making it known that you've done that as well. And also just be prudent too about, you know, identifying those that have or are suspected of having it, and making sure you're conducting those health screenings as well, and obviously keep those confidential.
Joe, you are on the Kent County Back to Work Task Force. Is there a recommended formal plan right now, or is this a task force that's putting together the concepts that people can learn about?
No, there's actually a pretty thorough set of plans that one can find on the website, which is kentcountybacktowork.com. This, by the way, is a partnership between Spectrum Health and the Kent County Health Department, the MSU College of Human Medicine, City of Grand Rapids, and Meyers. It's actually rather impressive, the work that's gone into it, and it doesn't matter where you live. You could live anywhere throughout the country. I think that there's great benefit in spending some time on this website that will really guide you, because a lot of it is pulled from CDC as well as just best practice in general. And so you can find a number of plans, and even some that are industry specific. So I would highly recommend that the attendees on today take an opportunity to go to that website again, kentcountybacktowork.com.
Great. And thanks for that, Joe. We'll publish those links as well as this presentation afterwards too, for any of the attendees that would like to visit that site.
Let's go on to measures that we can take to minimize risk as individuals are coming back to work. There's a little bit of fear. We'll talk about that in a moment too. Nikole, what have you found, especially on with what you do on a day-to-day basis in legal, to help really make sure that people feel comfortable, but the risks for coming back, make sense and are transparent to the employee?
I'm actually going to look at this in two ways. So there's, you talk risk, and there's risk to the employees and the people in the workforce. And the way to address that is to comply with the CDC protocols. Executive Order 2020-97 that came out last week, it replaced 91 that came out also last week. But 97 has a list of requirements that businesses must follow if you have workers reporting. And then section 1 is a general risk section or general requirement section that applies to everyone. But then Governor Whitmer has specific steps for kinds of businesses. There's an office section, which is section 7. Something in the office section is you have to turn off drinking fountains. That's not in some of the other sections. I mean, so these protocols, these requirements are specific. Manufacturers, as part of their daily screening of employees, need to be taking temperatures, but that doesn't necessarily apply to your offices. So employers really need to be looking at those steps and following those steps. One, because you want to prevent infection in the workplace and spread up, and those steps are designed to do that. 2 is you need your employees to feel like you care whether they get sick and that you're not putting the dollar above anything else. And so you need to take these affirmative steps. And what Ann said was being transparent about the measures that you're taking. I absolutely agree with that. And I recommend put up the sign, put up the guidance, and communicate the directives that people need to wear masks in hallways, things like that. But also communicate that I would condense it in writing. One of the requirements is that you have a COVID preparedness and response plan. That's a requirement section 1A, I believe, and it has to be in conformance with OSHA guidance. And one section of that response plan would be, what are you doing? What are your preventative measures? And a lot of that's going to be covered in the executive order, and you can certainly add to that. The executive order is not the maximum, it's the minimum of what you should be doing. And so having that communicated to your employees, that plan that should contain a list of your preventative measures, is really important. Putting it in writing, circulating it to your people, keeping them updated as to if there's any changes in those protocols, if you're going to allow visitors, non-essential or essential visitors in, depending on your workplace, what are you doing for that circumstance, and pointing those out to your workforce. I also recommend, from a legal compliance side for an employer, maintain a compliance file. There's a lot of requirements out there right now. They're not going to go away. Complying with Executive Order 97 is now an OSHA requirement. It's a MyOSHA requirement. Failure to do so is considered a MyOSHA violation. That's in the order. Last week, this order just came out last week, and I already have multiple clients who were served with OSHA or MyOSHA complaints because employees had called in and said people aren't wearing masks in the workplace. They're walking down the hallways. They're coming into my cubicle and crowding me. You need to, if you are taking the appropriate steps, which you should be, you need to be able to respond to that and show how you did that. So I recommend that employers have a compliance file where they have their COVID plan, where they, if you have signs up in the workplace, put copies of signs in there, take pictures of the signs up on the wall. If you have hand sanitizer everywhere, take pictures of that, email it to yourself so it's dated. So if you need to respond to MyOSHA and say, no, I am complying, or here's the steps I'm taking, you have documents to send them, and you don't need to go get statements from employees to confirm that, yes, I communicated this verbally. Keep copies of your designations that you need to designate your employees under the order for a lot of industries. Keep copies of those designations in there. Anything showing the preventative steps that you're taking, if you're being proactive about this, you want in one place so that you can go to that place and produce that documentation if needed. Make sure, though, on the health information, Ann mentioned this, is make sure that you can confidential with your screening because it contains health information. Limit the number of people that have access to all of that information because you do not want to reveal inadvertently or otherwise any protected health information. So.
Nikole, those are great answers. I mean, the fact that MyOSHA and whatnot is involved is interesting, and that's a new kind of new take. And I think that's a good segue also in Shawn. I think maybe you can comment on this. How do I phase employees in? So as part of that plan, how do I bring the employees back? Do I bring a portion in? Do we do staggered shifts? What does that look like?
Yeah, well, I'm going to say for us, it's been, a must to decide to phase employees in. And part of that is because of, you go back to the previous question about how do I minimize risk? Well, if we phase employees in, that helps us minimize the risk. And I completely agree with Nikole on how you educate employees before you bring them in and then document that. So we're doing a whole lot of that now. But when you take the time to have a phased in plan, you're able to address all types of employees that you have in your organization. So we're using like a color code system. And basically, if we've coded an employee with red, it means they're at risk. They're personally at risk if they contract this disease. If they're yellow, they live with someone who is at risk or continually in contact with someone who is at risk. And then green are the employees who really don't have any underlying risk factors that, should they be exposed, could potentially be fatal. Not saying that it couldn't be, but for the most part, not fatal. So what we've done is we've categorized every employee, and we've simply done that by asking them, what is your comfort level? What is your risk level when we do phase people back in? And they're very comfortable talking about that because they know we're asking them that for their own safety. And then we've got a phased in approach, but we don't foresee having any of our offices being at 100% capacity probably through year end. So we're starting with a 20% phase in, then we'll move that to 30, 40, and so on. But once we start phasing employees in, it'll be every 30 days evaluating. Do we need to pull some out? Can we put more in? Can we open more locations? Can we offer more services at each of those locations? Because ultimately it is all about the health and welfare of our employees and our members. And I think if you just go back to that number one rule of what do I need to do to keep my employees safe and my members safe, then, and you follow the rules that are set for you in the guidelines, then phasing in makes the most amount of sense, because also then you minimize exposure risk, to the rest of the employees as well.
The fear of when you say, let's phase in, and then all of a sudden you see the news stories, and the news stories are, let's just take the Ozarks over the weekend for the example of everybody just saying, I'm not going to follow any rules. I'm going to go and enjoy myself, and it's Memorial Weekend. And then you're asking employees to come in, and people have seen the Facebook post, so there's real fear going on. Joe, what do you see as helping mitigate that fear and help employees who are afraid to come back to work?
Yeah, there was actually a recent survey conducted by a global human resources consulting firm called Mercer, and they surveyed 735 U.S. employers, and more than 45% said they're already struggling with workers who are reluctant to return to their workplaces because of fear of getting sick, or they're afraid to return to work because they'll lose robust unemployment benefits, or they don't have childcare in place, and the list goes on and on. And so the fear is real, and I think it all starts with this potential getting sick that has really caused that's caused the most angst. And so there's a guy by the name of Peter Newell. He's a former Army colonel and turned entrepreneur, and he has a company that specializes in problem solving. And I came across this a couple of weeks ago, and I thought it was profound. It's relatively simple, but straight to the point, and he kind of provides three things that we should do, or employers should do, when really trying to prepare folks to come back to work and not operate in fear. One is, he says, you can't manage people's fears, but you can support them. This idea of, the power of fear, and, you have people who are afraid to come back to work, maybe because they have aging parents and they aren't able to see them. And the thought is, if I go to work, that's going to further delay my ability to see them. Or they're juggling childcare and work. And then there's the fear about economic security, or, as I mentioned, contracting the virus. And so the reality is, as employers, we can't eliminate those fears, but we can and should encourage our people to be honest about what they're feeling. And so in return, we need to be prepared to listen, then give them clear, transparent communication, which I think has been articulated here on this morning, about what we know, what we don't know, and what we're going to do, what we're doing as a business to lower the risks for staff. That's number one. Number two is to go deep on what returning to work looks like and all of its ramifications. You need to map out exactly what going back to work will look like for employees. How will you handle resuming face-to-face meetings, right? That's a big one. I've talked to a number of folks with the work that we do at the Urban League, a number of employers who are saying that, you know, the days of face-to-face, those are gone, at least for a season. And so, you know, there's this idea of needing to respond to employees' fears. Means thinking through these scenarios and coming up with alternatives. And so it's almost like playing this just, you know, kind of going through this scenario, a number of scenarios, because whatever we think is going to happen or come up, it most likely will. And the third thing is directly address the stress your employees are going through. So the reality is you know, this is just a stressful situation, and it hits people at different levels. Some are just, again, totally freaked out about the idea of going around anyone outside of their immediate family, let alone coworkers. And so we have to, I think, be prepared to try to reduce or eliminate as much of the stress as possible for our workforce as they return back to the workplace. And it could be anything from mandating no email or Slack messages on the weekend. It's about having frank conversations with everyone about finding ways to return to work refreshed, and also really trying to find out how are they taking time off to get away. I mean, the thought is not many folks will actually take a summer vacation, and so, you know, what are you doing to find peace in the midst of this return? And no one may have the answers right now, but one of the things that needs to be addressed is making sure that people's brains are refreshed, because again, they're stepping into uncharted waters, and there's just a big question mark for many. And so again, the fear is real, and we need to, I think, position ourselves to be very, very good listeners, and not in turn look to bark out orders, but just again to be that one that listens.
Yeah, well, that's profound and very insightful. You know, mental health is you know, becoming more and more of a hot topic right now, right? Kind of on the heels, or hopefully the heels of COVID. So, you know, that mental health aspect and just inquiring with your employees, how are they feeling? You know, what's going on? I think is extremely important right now. That's very insightful. Thank you.
Joe, if you wouldn't mind also continuing a little bit about, you know, the knowledge of what we should be doing to help employees, and how can we make sure that we're following the right guidelines, and do we have to follow them to the strict letter of the law? Like if you took at the CDC guidelines that are coming out, how is it that you have seen that the task force is approaching, saying, here are these specific guidelines? And I know, Nikole, you can second that in a moment on the risk side. Joe?
Yeah, I think everyone on this morning has really spoken to you know, the most strategic way forward, and that is to really take into consideration what the CDC is suggesting by way of their guidelines. I know that the King County Back to Work task force, that is really deeply rooted in what the CDC is suggesting. Cool thing about cdc.gov, which is the website, is they're very industry specific as well. And so it talks about the basics such as physical distancing, you know, keeping the workplace clean, but really having these protocols in place that hopefully will alleviate any stress or fear or concern, you know, for the workforce. And so I will tell you that here in Kent County, we have been very, very adamant about following what the CDC is saying, but really trying to take it and position it to where it's industry specific. You know, as an example, one working in a manufacturing environment is very different than one working in an office environment, and yet, you know, there's I think for a lot, especially those in manufacturing and in particular, you know, the density and the fact, or compared to an office setting where it's not difficult quite often to be 6 feet apart from someone, to have, you know, many businesses are putting up the plastic walls or the shields. Well, you know, heck, most of our workplaces already have something like that in place. And so We are trying to, here in Kent County at least, really trying to lead by example and recognize that there's great complexity in all of this, but there is a mindset at play here that we have to get back to work, and at the same time we don't want to have people feel as if they are being forced or pressured to get back to work, because we want them to come back as their best self, and that because when you do that, you're able to work perhaps hopefully at the optimum level compared to coming back to work operating in fear, doing it begrudgingly, not wanting to be there. And guess what? The work product shows that. So I give the folks at, between Meyers and the health department, the city of Grand Rapids and Spectrum and MSU, College of Human Medicine, I give them a lot of credit, because you're talking about folks who have significant expertise, even down to, this practice of using these non-contact thermometers, where they're, checking the temperatures of employees as they come to their workplace. And making sure that again, if there's a spike in their temperature, got to go home. Now they're paying them, and yet they're taking the necessary precautions. And I think it's just a well thought out a plan. But at the end of the day, there's always something, as I'm sure Nikole can support this idea of there's no answer for everything.
Right. And so I think that's maybe a good segue into the next kind of portion here, which is that first portion of how do we get our employees back to work safely, right, and protect them and their families as much as we possibly can, and then kind of overall workplace and overall safety concerns. One of the questions that we have for you, Joe, and maybe Nikole, you can kind of piggyback on this, is do I need to follow the CDC guidelines? They're called guidelines. Is it the letter of the law? What does that look like?
Nikole, why don't you pick up where Joe left off?
Yeah, the answer is yes. You need to follow the CDC guidelines for a couple of reasons. One is it's the right thing to do. The CDC is at the forefront of this. I totally agree with Joe. Their website is fantastic. I'm on there all the time because they also update things all the time. As new knowledge about this virus is coming out, the CDC is altering and amending and revising their guidance documents to reflect the information they're receiving. So it's a great source of information. It's a good place to go so you can figure out how to keep your people safe. But on top of that, the Executive Order 97 that I referenced actually inserted a requirement that employers must follow the return to work guidelines that are the then current return to work timeline set out by the CDC when they have a symptomatic and positive employee. It's a legal requirement right now for all employers to follow the CDC timelines on when you can have somebody who's been symptomatic or who's tested positive return to work. And the CDC specific, like Joe said, they're industry specific. They have timelines for essential employees. They have general timelines, and they've lengthened those timelines. Actually, they've moved them so it's a little bit longer than they were at the beginning. There was a timeline set out by the state of Michigan in Executive Order 36, which is also still in play, which prohibits employers from discriminating or retaliating against people who are symptomatic, who have been directly exposed. Employers are not allowed. It is a retaliation, discrimination violation. You are not allowed to discriminate against employees for taking time off under that order because they're symptomatic or were directly exposed. And there's a specific timeline in that order. Well, the CDC guidelines recommend a little bit longer timeline on the return to work. So employers need to comply with both. They're both in force. They need to comply with both. So they go to the timeline at the CDC, and then always don't retaliate or discriminate because people need to take that time off because they've been exposed or they're symptomatic. So yes, employers need to comply with CDC guidelines by executive order. They need to comply in order to keep their people safe. And also, I'm going to bring this back to MIOSHA because I think MIOSHA is going to have a very heavy presence in this pandemic going forward. They're going to be the people enforcing whether employers have met their obligation to keep their employees safe. And it's a legal obligation. It's a MIOSHA rule. You have to require, or you have to provide a safe workspace for your employees. And so even if the executive orders expire with the worker protections and Executive Order 97, even if that expires, that does not eliminate the obligation that you have to take the appropriate precautions and measures to keep your workplace safe. And I think following CDC guidelines meets that requirement, or at least will show that you tried to meet that requirement, or that you took all the measures that you could that were reasonable. So employers need to go to that website. It's a great website.
Nikole, thank you so much. Joe, thank you. And Joe mentioned a little bit about taking temperatures. And I know that there is a big discussion right now about wearing masks and taking temperatures, and is it mandatory? Anne, why don't you kick that question off? And then Shawn, tell us a little bit about what we're doing too at Consumers.
Okay, great. Well, the EEOC, and Nikole can probably verify this again, is gave employers the green light to take their temperatures, employees' temperatures, to try and ward off the spread of COVID-19 in a guidance that was updated back in March on the 18th. Generally, measuring an employee's body temperature is a medical examination, and the ADA prohibits medical examinations unless they are job related and consistent with business necessity. But because the CDC and state and local authorities have acknowledged community spread of COVID-19 and have issued related precautions, employers may measure employees' body temperature. But then again, it all comes back to what we've been talking about this morning. Some people may be symptomatic but not have a temperature. So that's another thing that we have to consider. And again, the temperature has to be kept confidential. And you need to make sure, and Nikole and Shawn can speak to this, you have the right people set aside to take these temperatures and make sure that they're trained and that they're wearing, the proper PPE. And also, again, it all goes back to the confidentiality. Make sure it's in a space. I've talked to several manufacturers who have tents set up prior to entering a certain door of the facility, and they're spacing 6 feet or more. So, everyone's curious, does Joe in front of me have a temperature? Well, I'm not going to go in if he does. So you got to keep, the spacing and the confidentiality and screens up just to make sure that everyone feels comfortable going through that process and not feeling like they're being violated.
Shawn, why don't you follow up?
Yeah, so I think it's definitely your option as an employer to take the temperature yourself. And there's some great tools out there. Even Joe spoke yesterday about a tool where it's a touchless temperature. We have 23 locations, so that's very costly.
Oop, Nikole, I think your audio dropped out.
And for me to be able to have someone at 23 locations to take temperatures is not feasible. It's a great tool. Spectrum Health has a free symptom checker, and we are asking employees to check into that symptom checker each and every day before they report to work. And then only myself and one other individual on my team gets a report from Spectrum if anyone comes up with a red flag. Those results are downloaded daily into an Excel spreadsheet, and we can just keep that on file. So if we do get at any time, Nikole's talked several times about my OSHA and OSHA. If at any point we get questioned on that, we will have those records to be able to say, hey, listen, we've asked employees to do this every day. We've verified that they do that. If we had a red flag, we took these steps. And so for us, that's the right solution. Honestly, if we were a one location shop, I'd do the touchless temperature sensors, because I think that's, an easy way to do it. That's less cumbersome, because ours will be harder administratively, especially when right now we only have a very small number of people reporting to work each day. But imagine when we're 100 or 200 people reporting to work each day, that will get much more cumbersome.
Great. That's fantastic feedback. So now, we've kind of talked about employees and workplace safety. A question that I have is, what happens if you are in a multi-tenant facility? Obviously you can put your own workplace protocols in place in those things to protect your employees, but what happens from a overall landlord building tenant perspective? Any insight there?
I've received some feedback from some folks, and basically they're stating it's your obligation to notify tenants based on their lease terms of public health mandates and state regulations. So if you notify a full building about a tenant's testing positive for the virus, you also have to consider, Nikole can probably speak to this better than myself, the privacy laws and regulations that surround that. Your notification shouldn't disclose, obviously, the individual's name or apartment number or suite number that they work in or other identifying characteristics. And again, it's wise to consult someone like Nikole or someone on her team to help you out with that. And then there was an individual who has multi-locations, and it's a healthcare here in Grand Rapids in a multi-unit facility, and their policy is company specific. They're not collaborating with any of the other units. They're keeping the other units in mind, but with things moving so quickly, they're not looking and cannot collaborate with the others, just because, as even Nikole stated last week, there was 2 different executive orders coming down from Lansing, and things are just moving so quickly, it's just hard to do that.
Yeah, if I can follow up on that, I agree with everything Ann said. You need to be, if you're in a multi-tenant unit, you're the employer and you're one of the tenants, you need to look at your lease with your landlord and approach your landlord. My firm is, we're in a large old factory and we have a couple floors of it, but it's multi-use and we're one tenant. We looked at our lease, we went to our landlord and asked a few questions. One, are you going to tell us if somebody tests positive? Not every landlord is, and they're not required to at this point under the leases that we're aware of. So you may not get the answer that you want on that question, but ask the question and keep that in mind when you're renegotiating your lease. If you're on a yearly lease, you should look at that and keep this pandemic in mind in your lease terms and put mandatory disclosures. Absolutely should confidentiality be maintained. That person's name cannot be used, but a notification of, hey, heads up, somebody who's in the building has tested positive is something that you're going to want to know, so you can communicate that to your workforce. Other questions we ask, though, are how are you increasing disinfection of common touch surfaces? We go through the building's doors, then we go through our office's doors. We control everything from our office door in. How much disinfection are you doing on the building door? How often is it happening? Because quite frankly, if they're not going to do it, we might increase and say, okay, we're going to have our person that's doing common touch disinfection take that 5 steps out the door and disinfect the building door as well. We just want to know what measures are being taken by the building and then keep that in mind when negotiating our lease going forward.
Nikole, quickly, when it is a COVID-19 case, how is it deemed work related? And then Shawn, if you could answer, well, then what happens? How do you handle a case that comes into the workplace? Nikole?
So first of all, any COVID-19 place, if that person has been to work, is work related insofar as you need to treat every case as incredibly urgent and you need to follow your response protocols, which Shawn will get into. So it does not matter. If you have a person come to you and they test positive or they're symptomatic, the response is not, well, you didn't get it here, so I'm not going to do A, B, and C. That does not matter. You need to follow your response plan. It doesn't matter where they got it. You respond accordingly and with urgency. There is a legal aspect, though, to connecting a COVID-19 diagnosis with work, and that's workers' compensation. And I've had this question from clients. If they have a worker test positive, do they report it as a workers' compensation claim? Is that workers' compensation is a statute in Michigan that entitles employees who suffer a personal injury out of and in the course of employment. They're entitled to certain benefits, coverage for health expenses, wage replacement to some extent, depending on the amount of time they miss an injury. And so these are benefits. Most all employers should have workers' compensation insurance. And under circumstances, normally, if an employee gets sick from work, if they are injured at work, then you report that to workers' comp and you treat it accordingly, and it's processed, that claim. With COVID, it's difficult because it's hard to figure out, did they get it at work, did they get it elsewhere? So from a workers' compensation perspective, one thing that's interesting is the state government on March 30th issued rules, emergency rules, saying that there is now for first response employees, which is a defined term, it includes mostly medical personnel, nurses, firefighters, police officers, paramedics, doctors, ambulance staff. For anybody that falls in that first response employees category, there is a presumption that if they are sick, if they are diagnosed by a doctor or receive a positive diagnosis via test, there is a presumption that they were infected at work and they are entitled to a claim unless the employer can show that the worker was not directly exposed at work. So if you have employees in that category, It is a workers' compensation claim. You need to report it immediately to your workers' compensation carrier and treat it accordingly. If you do not have people in that category, there is no automatic presumption right now. There are some laws that are in our state governments that have been proposed, trying to extend that protection of presumption, but right now there's not. So the state website has facts on coronavirus and COVID that they're answering questions that are set forth, and they have a number of them about workers' compensation. What they say is, you don't know. Either an employee or an employer can treat it as a workers' compensation claim and report it, but they don't have to. And the employee would still need to show a connection between work and the infection. And what they're saying on the state website right now is that the employee needs to show, quote, specific exposure to COVID-19 by date, location, details. So if you're sick, if you're the employee and you believe this, you were sick and infected at work, and so you're entitled to those worker compensation benefits, you need to write down, how were you exposed? Why do you believe that you were exposed at work? And that's the information that'll be considered when deciding whether you're entitled to those benefits or not.
So Shawn, a case comes up, it's confirmed. What is an employer to do? How do you handle it?
Yeah, so that's been something that we have faced. And so it speaks very near and dear to my heart. In the case that an employee, one, knows that they were exposed. So that's always step one. So typically somebody says, hey, I've been exposed directly, close contact with someone who's been diagnosed with COVID. So our step one in that case is to immediately ask the employee to quarantine themselves according to CDC guidelines. I'm not going to go through all those guidelines, but quarantine themselves accordingly. And then if they do develop symptoms, right? So step two is they start to develop symptoms, then we ask them, well, now they can get testing, which is amazing. But in the beginning of this, they couldn't necessarily get testing. So if they develop symptoms, we would say, hey, let's just treat as if you have COVID and you cannot come to work until X. At which point, whether they are a confirmed case through testing or they had direct exposure and they had symptoms and couldn't get testing, we then take a strict course of action at work. So in the case where we had the employee diagnosed, we had quarantined that employee from the minute they knew they had been potentially exposed to COVID. So there was a 3-day period, or actually 5 days, before they actually experienced any kind of symptoms, at which point we informed every single person in the location that, hey, you have been exposed to somebody who has had COVID. I asked that employee at that time if they were okay with me sharing who. Well, there was only 5 people in the location, so they were going to know who anyway. But the reality is then that way each employee could go through and determine had they had any close contact so that they could take extra precautions even with their own family. So we took all of those employees, we quarantined them then for the next, for that 14-day period since the last exposure. We shut down the office. We fully sanitized it twice. And we didn't allow anyone back in for at least 7 days following the sanitation. And that's just been our rule of thumb. Now, we are probably extra cautious. The CDC does not require we do all that we did, but that's been our course of action. And part of the reason that's been our course of action is because I've talked to other employees who work through other organizations who got a text message that says, hey, somebody was in our building, and they had COVID-19. And that employee has no idea whether they were exposed, not exposed, were they in the building at the same time as that employee. So we're taking extra precautions because, again, we're following that #1 rule of keeping our employees safe and keeping our members safe. What's really great about being extra cautious is no one else has gotten COVID from a coworker or developed any sort of symptoms, right? So that's what we're trying to do. We're trying to avoid more people getting sick. And so if it happens in our corporate office, we would take the same precautions. The only difference to that is that's a 92,000 square foot building. So we're using social distancing and sectioning. So we don't necessarily need to close down the entire building, but we close down the entire section in which that employee was working. So you have to use it based on what your locations allow and what works, but we don't want to have 60 cases of COVID at Consumers Credit Union. So by taking extra precaution, you have the ability to avoid your employees getting sick or your customers getting sick.
Great, thank you. So, getting down to specifics, what do I need to do? What is the obligation to report a COVID-19 case? Who do I report that to? Are there links out there? What are the resources that I need to make sure that I contact?
Shawn?
Oh, is that for me? I'm sorry.
I'm sorry, I should have directed that to you, Shawn.
I'm sorry. Yeah, so when you need to report a COVID case, now I have a direct line. I've established a very good relationship with the health departments in each of our markets. So the very first thing I do when we have a potential COVID case is contact the health department and find out if there's any updates, what steps I should take. And they're really great about giving you instructions on what you need to do. Because like Nikole said and Joe said, these are living, breathing, constant changing criteria of, yesterday we might have done this, but today we're going to do this. So I always want to make sure, even though the CDC guidelines say X, I want to call the health department and say, hey, is there any additional steps I could take? It also helps when you're, as an employer, you have a good relationship with them, because it helps when you want to get your employees tested. Like, hey, I've got this situation. I think there's potential exposure. Where can I get my employee fast track tested? And as long as you've got a good relationship with, they're extra helpful. And so we've just taken those steps to establish that. From a workers' comp perspective, like Nikole said, there's really, you don't have to report it to OSHA or workers' comp unless it's very clearly employee X had the COVID, employee Y was sitting right next to them when they were exposed, and you can actually prove that they got it that way. So from a reporting structure, you don't have to report to either of those entities unless it's very clearly, work related. Our approach has been, regardless of whether it's diagnosed, not diagnosed, or we're just sending you home as a precautionary because you may potentially were exposed to an employee, we're just paying people 100% for as long as we need to make that happen. So we haven't really broached the workers' comp or the OSHA piece at this point, but I'm also keeping a record. So it's not reporting it to anyone, but like Nikole said, dot your I's, cross your T's. So we're keeping a record of who we've quarantined, when we've quarantined them, why we've quarantined them, and when we allowed them to return to work. Because should we ever get a complaint filed that we didn't follow guidelines, I want to be able to show that we've got that. So it's really more about record keeping.
Gotcha.
Sorry, if I can jump in here, Dan. I keep harping to Executive Order 97, but what Shawn said about calling the health department, you are required to do that within 24 hours. This is covered in Executive Order 97. Within 24 hours, employers, if they have a positive case, need to notify the health department. They need to notify contractors, vendors, and others who had direct contact with that employee about their potential exposure. So it is the right thing to do, but it is also the mandated thing to do. Same thing on the logging. If you're sending people and quarantining them and they have positives, depending on your industry, you're required to keep that log. Manufacturers have to keep that log. I don't believe offices do, but they should be, simply so you can track, have a central place where it is, so you know how long people have been out and you have a place to store notes about when they're coming back to work. And again, keep that confidential. But please do look at Executive Order 97, because a lot of what we've talked about today has been reduced to writing and it is mandated.
Thank you so much, Nikole. Hey, Joe, if you'll do us a favor while we ask for questions, if anybody does have any questions for any of our panel guests, please send them in on chat as we go. We have just a few more minutes left. Joe, can you recap again the Kent County Task Force web and some of the things that we've talked about today and what is happening on the task force?
Sure. Again, it's Kent County Back to Work, and this is a collaboration between the Kent County Health Department, Michigan State University College of Human Medicine. And what it does is it helps to it aims to help employers maintain a healthy work environment, outline best practices to promptly identify and isolate sick employees, confidentially gather and track employee health data countywide on a daily basis, and aggregate that data to guide community level strategies to help stop the spread of COVID-19 as West Michigan gets back to work. Meyers is a major player in all of this. So they're a part of the partnership, as well as the City of Grand Rapids and Spectrum Health. And they piloted over a 1 month period to maintain a healthy work environment for 35,000 employees at 225 Meyers locations. Okay, so again, Meyers kind of like they're the test case, the pilot, and they have again led with they're a perfect example of how it should be done, and the results are showing. And so again, I would just encourage everyone who's on this webinar to take a look at the KentCountyBackToWork.com website. And the one point that I did make just now that I think is critically important is, this constant communication with the Kent County Health Department. That helps out tremendously. Kent County Health Department has done a phenomenal job. They've developed a really an awesome dashboard that is ever evolving, that really spits out data. It's getting now, well, I'm actually working and advocating for getting it down to the census tract. I mean, they have it down to city, to zip code. I want census tract, but gender, obviously, race and ethnicity, you name it. And part of the work of Kent County Back to Work is they are informing, where the employees are informing the county, and the county is again, making mention of individuals who are being infected by the virus. And what they're doing is they're tapping into wherever that workplace is, that zip code is. They're also listing that's where the virus, that's where the infected individual works. And so again, great tool and something that I think everyone here would benefit from.
I know, Shawn, you mentioned that you have a list of every county health department that is in our service area. So if you have multiple service areas, it's really important to make sure that you've got those county numbers right next to you. Dan, do we have some questions?
We do, and yeah, just to be clear, if you do have a question, post it in the question section, not the chat. And we do have one question so far, which is, what laboratory are you utilizing for testing? So, I think that's a great question. What is a confirmed case? Is it up to the responsibility of the individual to go in and get tested? What does that process look like?
Shawn, you want to take that quick?
Sure. There's in each of our areas, there's different testing facilities. So when you contact the health department, they'll direct you on where to send the employee based on, smaller communities only may have one, so it's pretty clear where to send them. But in Kalamazoo, there's a couple. In Ottawa County, there's a couple. Kent County, there's a couple. So we haven't had any cases in any of those outlying areas. Fortunately, they've all been in Kalamazoo County. So it's been very simple. Like Loy Norrick's high school has it right in the parking lot. And we've had 4 employees get tested there. So they'll direct you. You just simply ask the health department, hey, I've got an employee we suspect has COVID. They'll ask you all of these questions about how potential exposure, do they know they were exposed? They'll ask you a bunch of questions about that, and then they'll direct you on where to go. You don't want employees just showing up and going to the testing sites, because that makes it much more difficult for them to get the testing. They won't just let them go through. You have to call in advance. So the employee can call. We've had a couple employees say, hey, I want to get tested. I'm not feeling good. And then we still facilitate that. But a lot of times employees can just call. If they're essential workers and they're working right now, they can absolutely get a test.
Good to know. And I believe we have someone on from NextGen, and they said that they've been helping local resources such as employers and hospitals as well.
Any other questions?
We do have another question. Our office is undergoing a complete renovation that includes more of an open floor plan and fewer barriers between employees. Given COVID-19, what does everyone think about the future of office layouts, open desk and floor plans, and worker safety?
Who wants to take that on the panel? Raise your hand.
I can do that.
Go ahead, Nikole.
So this is actually interesting for me. I'm on our firm's management committee. It's a 3-person elected committee to run the firm. And we've been looking at our blueprint because our lease term is up in a couple months, and this came up when we were talking to people as, do we want a more open floor plan? Do we not? I think COVID is going to lead to a decline in the open floor plan concept, because having an open floor plan means that when you have an infectious disease now, it might not be COVID-19 next time, but we're going to face this again, I think, with COVID and with others. You have to take structural modifications. You need to put up the physical barriers. You need to space your employees where you would not have as jarring of a required response if your floor plan was already set up to keep division between your employees and among your employees and yourselves. So I think that there will absolutely be a decline in the open floor plan concept as a result of the pandemic.
We have an open floor plan, so I can speak to it just a little bit about how to do it if you have a open floor plan. So our desks are large in our open floor plan, and so there's social distancing already built in, so you're more than 6 feet apart from the person across from you and more than 6 feet apart from the person next to you. But our approach has been, let's go even more extreme to that before we add the plexiglass in. I think that would be our next step. If we're back to 100%, we would have to make those modifications like Nikole said, or we would choose to. We don't have to because they're more than 6 feet apart, but I think we would choose to do that. Right now, we're only using every other space. So you can only sit kitty corner from someone, so you're more than 10 feet apart from the person closest to you. So that's our approach. We've taken all of our common spaces, so like the lunch area, and minimized chairs, like maybe 1 chair at a table or max of 2 chairs at a table if it's a large table. Our conference rooms, we're sectioning off, they're only 1-person rooms. Bathrooms, you can only use 2 stalls. So, you know, in the open environment, there is a little more challenge with that, but you know, if you have a good ventilation system, you're actually in pretty good shape because it does help with the fresh air and the flow of air. So I think you just have to take extra precautions and be ready to implement structural additions when you're back at 100%.
That's great insight. And I know, you know, I've heard from several business owners just rethinking, maybe they were talking about a, you know, 3 or 5 year plan of building renovations and those types of things. And now they're rethinking even the work from home strategy. So, you know, obviously that depends on your business and the type of business and whatnot, but definitely I know folks out there are considering that.
Well, I'll tell you what, it is definitely a new employee experience to return to work safely. And we cannot thank our panelists enough, Ann and Nikole, Joe and Shawn. Just wonderful information. We will be sending this out as a link right when we wrap up here. We'll edit it and get it out to you so you can share with other people that you know really need to hear about this expertise.
Absolutely. No, it's great. Thanks so much to the panelists. Thanks so much for the attendees for joining us today. Definitely look for part 2 of the webinar and part 3 of the webinar. It's a very intentional kind of 3-part plan of getting back to work. So hopefully we see you on the next call. Thanks so much for joining us.
Have a great day and make it safe.
Thank
Take
you.
care. Bye-bye.
Yeah.